Say hello to CBRC. What does CBRC stand for? That's easy. We are the Community-Based Research Center, and we are dedicated to supporting the health of queer, trans, and two-spirit people across Canada. But what does community-based research mean? Well, that takes a little longer to answer. This is a story that starts more than 25 years ago, back in 1999, when CBRC was founded and led by a small group of gay men in British Columbia who were deeply concerned by the way gay and bisexual men were being treated in the midst of the HIV epidemic.
Rick and Terry are this beautiful couple who are like the grandfathers of queer health in Canada, in my opinion. So much of what we have today in terms of infrastructure is accredited to Rick and Terry and their vision as the founders of CBRC.
They started the organization in 1999, which is a really important moment if we look at the epidemiology of HIV. In the late 90s and early aughts, we started to see an increase in HIV cases, and the narrative that was being put forward by people was that gay men were behaving recklessly.
I think the broader sort of thought on it was like, well, why are you getting it? You should know better, just use a condom. And so there was a lot of blame being put on people.
Rick and Terry really, and other gay men, saw this narrative as incomplete. They saw that only focusing on the behaviors, the sexual behaviors of gay men, was missing a big part of the story.
It was near impossible to find information about gay men's health. People weren't talking about it. People weren't studying it. There was very little research. There was very little data.
There was no funding. There was only pushback and prejudice and bad comments and, really threatening things around isolation. We had seen, so many of our friends die and feeling so helpless.
That really scarred and traumatized a lot of gay men. And I think, I'm emotional thinking about it. They experienced a lot of loss, and I think they experienced a lot of structural, what we now call structural stigma. Just really, willful ignorance and dismissal on the part of governments.
We had a sense that there was another crisis coming if we couldn't tackle this. We have all these young gay men at risk.
It's easy to ignore a population when you don't have any data on them. The less data you have, the less you have to serve the people that data is about.
So in the early aughts, they started to go to pride festivals throughout British Columbia, and they started surveying gay men to understand what else was going on in their lives.
People were really excited to take part in the survey because a lot of guys said, no one's ever asked us to do this before. No one's ever come to me and said, how many guys have you had sex with in the last year?
And they started to hear about things like, what were their social networks like? Who did they go to for support? What were their experiences like in the healthcare system?
There were lineups of gay guys trying to participate in this survey because for once they got to talk about their lives, their sex lives, what they were up to in a frank and honest way.
Certain academics really resisted the idea of communities getting involved in research. But that, in a sense, that resistance was what told us we were on the right track. We weren't taking away their data, we weren't going begging for their data. And so with all these ideas, it just seemed natural that we call ourselves a community-based research center. I think we wanted to call it institute at first, but that seemed a bit too academic.
The early days involved sitting around the dining table for board meetings, breaking bread, sharing stories, laughing, sharing grief.
CBRC had a name and a mission, but Rick and Terry soon realized that for the work to continue, they needed to look ahead to the next generation.
I think Rick and Terry saw a generation of folks die, and they knew how important it was to ensure that the next generations received the kind of education and awareness that perhaps the folks before us didn't.
And the first programs that they developed out of the CBRC, like Totally Outright and the investigators, were quite intentionally focused on young people.
Donc, le programme Investigators ou Jeunes chercheurs queer est très important, je pense, pour nos communautés. L'idée, c'était vraiment d'aller mobiliser les jeunes qui sont intéressés par la santé de nos communautés, mais aussi le monde de la recherche, et de renforcer leurs capacités. Et on voit que les jeunes qui passent par le programme, ils voient leur capacité à faire de la recherche, à comprendre les enjeux de LGBTQIA+, de nouvelles façons, voient leur capacité grandir. Puis ça les motive beaucoup à continuer à faire le travail.
Programs like Totally Outright, the Investigators, they turned out graduates who went on to assume leadership roles in the queer health community, in public health. Leaders like myself, leaders like the current executive director, Michael Quagg, were all graduates of those programs.
I heard about this really interesting position working on a project called Totally Outright. At that point in time in my circumstances, it really sounded like an oxymoron. This idea that you could be healthy as a gay man, and of course that was heavily influenced by the fact that I had a really difficult coming out experience. Having grown up in a religious, conservative Korean immigrant family, where I just knew that the response wasn't going to be positive. They actually referred me to an ex-gay Christian therapist. So the experience of getting involved with Totally Outright really was a novel experience.
Michael wasn't the only one to join CBRC and find himself in its programs.
So I came to Canada in 2018 from Turkey. When I came in, it was really isolating. The investigators gave me that space to be connected not only as in a volunteer or worker space in an HIV, STD, VI, sexual health research space, but also, I made good friendships.
I grew up in Pincher Creek, Alberta. I'm a member of Piikani Nation in southern Alberta, Treaty 7. I'd never been exposed to the idea of what it meant to be gay, two-spirit, or queer. Fresh off the farm, I saw an ad for a program called Totally Outright. And then in 2017, I ended up joining a cohort of the Investigators in Toronto. Participating in those programs was really what I needed to feel a part of the community, finally. Connecting with people that had the same interests as me, the same passions for change and advocacy as me.
As more people joined the organization, CBRC looked toward finding a more permanent home.
Our first office was in a building called the Galleria down by Granville Island, Vancouver. And it was a very small little office, but it was a really exciting, vibrant little space. The first board meeting there, we sort of felt like, wow, we've really achieved something.
It became a very important meeting space once Totally Outright and the Investigators started to pick up steam. It was a place where, gather and have a journal club, you can gather and have a meal.
When I walked into the CBRC office for that very first interview, I remember just feeling so impressed and feeling so safe. I didn't realize it at the time, but walking into that office, CBRC's office, to apply for that job was nothing short of a life-changing, transformative experience.
Soon, an office in Vancouver became another in Toronto, and then staff were hired across the country.
The programs were recognized as successful and having impact. So the Public Health Agency came to the CBRC and they said, we want you to scale your work up. We want you to take it national. And in about 2017 was when our first national funding came to the organization.
I think one of the best elements of CBRC having so many staff across the country is that we can bring issues to light that might otherwise be missed. Atlantic Canada is very rural. 50% of our population are technically defined as rural populations. And when you come to bigger cities, they don't necessarily understand the issues in the same way.
One of my highlights working in CBRC was actually going back to my home during our powwow last year. And to have that platform to speak to my own community directly about what it means to be two-spirit, about HIV, about sexual health, I would not have that information and that strength if it had not been for what CBRC has been able to give me.
En grande partie, les communautés francophones vivent dans des communautés rurales, que ce soit au Québec ou ailleurs au Canada. Donc, en vivant en communauté rurale, on a accès à beaucoup moins de services et beaucoup moins de connaissances en matière de recherche, juste parce que l'infrastructure n'est pas vraiment portée à ça. Donc, il est très important que CBRC continue à servir les communautés francophones pour augmenter cet accès.
As CBRC made inroads in different communities across Canada, its biggest event, the Summit, became a major gathering point.
Part of what makes the Summit so unique is that it's communities that are running the show. It's, for many people, the very first time that they've, had a program that was developed by and for community members, not for a university, not for some academic program.
When I went to university, I was in a program where I was the only gay man who was out. In the program, I was the only one looking at HIV and gay men's communities. And I really struggled to find community. I found CBRC, and they had at that time this BC Gay Men's Health Summit, which did not exist in Ontario. It didn't exist anywhere else that I'd ever seen. And to see a room filled with folks in the community who had shared interests and passions around that was amazing.
Through all its growth, CBRC never lost sight of what made it unique and valuable: its focus on community-based research.
Community-based research is one of these terms that gets thrown out a lot in our communities and in the sector, but it's not very well defined a lot of the time.
On the one hand, it feels really intuitive. Well, it's research that is driven by the community, but that can mean a lot of different things.
For me, what community-based research means is that communities, our communities in this case, to us LGBTQ folks, are really leading and steering the work that we're doing in a meaningful way. We're from these communities, we're part of these communities, so we're very invested in ensuring that the research actually improves the health and well-being of folks.
And that tradition of queer-led, community-based research continues today with Sex Now and other Canada-wide research projects like Our Health.
Donc, c'est une étude qui étudie la santé des populations d'ES LGBTQ+. Et plus précisément, on regarde vraiment différents aspects de la santé physique, la santé mentale, la santé sexuelle. Donc, c'est la plus grande étude au Canada. Elle est multilingue, on l'a fait en anglais, en français et en espagnol. Ça permet vraiment d'avoir le plus de gens possible qui répondent. Ce que ça fait, c'est vraiment ça permet de comprendre les enjeux de santé qui sont dans nos communautés.
Sex Now is a pretty clear example of what community-based research can be and look like, and what kind of impact that it can actually have.
With Sex Now's huge data set, CBRC was able to make evidence-based arguments to the government in order to make life better for queer, trans, and two-spirit people.
So one example is blood donation policy. A few years back, men who had sex with men at all in their lifetime couldn't donate blood at all. But through Sex Now, we did a lot of advocacy work to ensure that more folks in our communities could donate blood.
Another major application of CBRC's research was in support of criminalizing conversion practices in Canada in 2022.
When you go to the Ministry of Justice website and you read Minister Lametti's account for how and why this came about, CBRC and the Sex Now survey are a huge part of that foundational knowledge.
The survey itself will continue to evolve as the needs of our communities change. Like one example I can just think of off the top of my head is that, we were in the field doing Sex Now in 2022 across Canada, and all of a sudden we were dealing with an Mpox outbreak. We were able to just add a couple of questions really quickly to the survey so that we could collect some data. And it's that kind of nimbleness and responsiveness that I think makes Sex Now sometimes a really important tool or vehicle.
Yet, as CBRC expanded its scope from HIV, it had to reckon with what that meant for its identity as a queer men's organization.
At some point, we realized that HIV was connected to broader health. And so to be able to do good HIV work, to be able to respond to HIV, you had to work in other spheres. And when you do that, it's much more difficult to do that from a strictly gay men's lens. So the transition from a gay men's organization into a broader queer health organization really had to do with the social determinants and the upstream factors of HIV, and recognizing that to do work in mental health for the queer community and to leave women and trans folks behind, it just wasn't fair.
In 2021, CBRC officially expanded its mandate to serve all people of diverse sexual orientations and gender identities.
When I walk into a CBRC event, including the summit, I have seen a lot of faces that are similar to mine. I've seen a lot of trans and gender diverse people, and also trans femme inclusion was there as well. So it's really inspiring to see how that inclusion is engaged meaningfully.
Il y a une histoire de marginalisation de plusieurs communautés. On parle particulièrement des communautés noires et des communautés autochtones, où, à cause du stigma qui existe, par exemple, chez les personnes qui vivent avec le VIH ou des membres de la communauté de LGBTQIA+, ils vivent souvent avec des impacts sur la santé qui sont beaucoup plus négatifs de par le fait qu'ils sont membres de sa communauté. Donc c'est très important que CBRC représente ces voix dans le travail qu'on fait pour pouvoir vraiment développer du travail en commun où on pourra trouver des solutions en commun à des problèmes qui font partie de toute notre communauté.
A crucial part of that diversifying work included walking the path of truth and reconciliation.
So as a non-Indigenous organization, it's incredibly important for us to be intentional and thoughtful about our work around truth and reconciliation, around how we meaningfully engage with Two-Spirit and LGBTQIA+ Indigenous people.
Back in 2016, CBRC made a commitment to the Truth and Reconciliation's calls to action. Community held them accountable to it, and in 2020, the first position within the Two-Spirit program was hired.
I've been with CBRC for the last 3 years. Over the last 3 years, when I started, it was just myself, and now we've grown to a team of 5 with potential further growth in the near future. So seeing that growth, seeing the investment from CBRC and from community is one of my biggest joys and prides at CBRC, to see that growth over just 3 years.
It really is something pretty exciting for all of us, because being able to come together and connect with remote areas, be able to create projects like the Medicine Bundle project, which has been so amazing, and to watch the impact when people receive that. I think going forward, the Two-Spirit program is going to continue to be visible, to provide support to our vulnerable communities, but also help our Two-Spirit kin come into ceremony and be able to navigate their lived experience with a hope.
It's with this hope that CBRC looks to the future, honoring its past 25 years and becoming an even stronger organization.
It feels amazing. I kind of feel old. I can't believe it's been 25 years.
I don't think anyone expected CBRC to be around for 25 years. And even as we're having advances in HIV, there are other things that we still need community-based data on. So I think CBRC is maturing like a good wine.
It is wild that this organization is 25 years old now. From a little kitchen table organization in Vancouver to a national organization with like 40 full-time staff. It's pretty incredible.
C'est incroyable que l'organisation ait pu faire ce travail pendant 25 ans et qu'avec les projets qu'on a et de la manière dont on continue, on est très fort et on pourra continuer à faire ce travail avec nos communautés pendant encore longtemps.
When I walked into the organization almost 20 years ago, I had no idea that it was going to lead to this path and this incredible journey of learning, of self-discovery. It's hard to put into words exactly what that means to me, but I feel it on an emotional level kind of every single day.
I think back to that little boy in Alberta at 14, 15, 16, and how important it is for us to continue doing this work coast to coast to make sure that people like him aren't left behind.
For 25 years, CBRC has proven that we as queer, trans, and Two-Spirit people can lead our own research, design our own solutions, and build our own future. So here's to that future, one that's better, freer, and healthier for us all.